Good afternoon. My name is Matthew Queree. I'm the research coordinator at the SCIRE Professional SCIREproject.com. We've assembled a panel of folks today to talk about mental health and spinal cord injury in the time of COVID. And I would like our team to introduce themselves. We'll start with you, Brad.
Hi, I'm Brad Skeats from Vancouver. I'm a participant at Park at ICORD, the gym. Done some social work at school, and I've also been a long-time volunteer at Children's Hospice and also at Ronald McDonald House.
And I'm also from a research participant from Park, the Physical Activity Research Center with ICORD, like Brad, and we're both actually involved in the Community Engagement Committee, which does some supportive work there. And also I volunteer with Van Dusen Gardens here, only not at the moment. And also I am a social worker as well, a retired social worker. So, and I think that it may have been asked by what level of injury I have, which is I have paraplegia and I walk with forearm crutches and leg braces.
Yeah, maybe I should jump in there and just, I use a manual wheelchair and C7 quadriplegic spinal cord injury. Thanks, Kevin.
I'm Rachael Neal. I work part-time with GS Strong in the spinal cord injury unit and both the inpatient and outpatient programs there. And then I work part-time in private practice as a psychotherapist here in Vancouver as well.
Excellent. Thanks to all for joining us. So yeah, the topic of discussion is mental health and spinal cord injury in the time of COVID. We should jump in and just ask, are these issues, I guess, are probably more present now in the time of COVID, spending more time alone and what have you. I guess I'll I'll ask Brad to maybe start the questions.
Yeah, it's, mental health is not the easiest thing to address or to think about, whether engaging with other people or even addressing on your own, especially during a time like this with some of the isolation and the shutdown of activities like volunteer work, paid work, and so on and so forth. So I think one of the concerns I would have is, wondering, because of the spinal cord injury, if there's a higher risk of mental health issues, and if there's any extra concerns I should have in that area.
Oftentimes when we're thinking about a physical health condition that has impacted someone's life, whether that is a spinal cord injury or another serious illness or disease process, we do see a higher incidence of depression, anxiety, or adjustment concerns. What is interesting is that we often see these rates being highest in the period immediately after injury. And then we do see some degree of course of adjustment and getting used to what life is like after that injury. And so when we're thinking about something like a pandemic that is then on top of a stressful life situation or life change, like a spinal cord injury, we can then see some increased incidence again of things like low mood, increased worry, some difficulties adjusting to this new normal that we're all trying to sort through at this time. And so it is something that can be helpful to see, how am I doing? How are those closest to me doing? But we really want to be thinking, statistics are one thing, but how am I doing, or how are those closest to me doing? The numbers can be informative, but what can be most helpful is looking at, for each of us, what is our own history? We always know ourselves better than any other person can, arguably for some folks probably with close relationships, but am I noticing changes in myself? Am I noticing changes in those closest to me? And do those changes concern me? Is that something that I'm thinking about or that I'm worried about? And if that was something that you're finding yourself answering yes to, then that could be a time then, we could think about bringing in those extra supports as well.
So another issue that often goes hand in hand with mental health issues is substance use and misuse. I've heard of folks during this time they're maybe drinking more, maybe drinking less, maybe using cannabis more, maybe cannabis less as a coping mechanism. And I know cannabis, a lot of people in the SCI community use it to manage pain and spasticity. Some people have been eating a lot and too much or not enough or what have you. What do our folks think about substance use and misuse in the time of COVID?
I'm not a cannabis user, and also I find my drinking tends to be social, so I'm not kind of fitting in with those categories at all. I'm not drinking anymore. In fact, I'm probably drinking less because I'm not being very sociable. I'm not doing the online Zoom cocktail parties or whatever, glass of wine. So that hasn't been affecting me. But I know when we were having some discussion at one point talking about the dynamics involved around, you know, addictive behaviors or whatever else and what some can do or not. I certainly think that when I was listening, the food kind of can fit in there. So if you're used to cooking and having guests come all the time, all of a sudden you're cooking these wonderful healthful meals and your whole focus is, because you have lots of time to think about it, your focus is on the food, and you know, you may eat too much of even though it's good healthy food, it's not necessarily the amount as well, and kind of dealing with that balance. So I think in some ways it shows up in different ways, I find, for other people. And I know that there's some very skilled green thumb gardeners in our gym who have some talent in that area, and a lot of people do tend to use it, especially cannabis, for different medical reasons, whether it's spasticity, pain, or nausea or whatever, eating. So I think that may be balance point. I don't know, Brad, what do you think about that?
Yeah, personally, I mean, much like you, I found my consumption of all those things, food, I don't use cannabis anyway. Yeah, alcohol, food, I find those are very social things for sure. Personally, and I know you're much the same with the exercise and having access to that at home, that continuing that routine limits my desire for either junk food or more food or alcohol as well. So having that routine for myself has been very helpful. And even just not being out, you know, grocery shopping as much, I find I'm not out hitting the liquor store, you know, while I'm out getting my groceries, you know, as well. So simple things like that can change. But that being said, I know it can be a struggle for sure. Fortunately, you know, I've been able to keep that in check, but I know it's definitely a challenge for people out there. And like you, it's a social thing for me. So, you know, limiting the social contact also means naturally limiting the drinking, you know, whether it's at concerts and sporting events as well, stuff like that. It's just the opportunities that I usually take to have some drinks are just not there right now.
Interesting. I know that you're both speaking to this idea of quite a lot of variability within the SCI community in terms of how much or if at all folks are using things like alcohol or cannabis or other types of recreational drugs as well. And there were some questions, I think, around how do I know if I'm using too much, or if any changes in how much I'm using or when I'm using are something I should be concerned about. You know, one of the things we can always think about is, if we take a step back, what are those basics of some of the guidelines? So there are guidelines that have been put out by Canada Health, for instance, around things like alcohol consumption. With, of course, the caveat there that for folks with SCI, we know that alcohol can affect folks differently after injury versus before. And so even if it is that someone is drinking within Canada health guidelines for alcohol, it could still be that's the way that alcohol is affecting us, or how we're using it could still be, you know, something of concern depending on what's going on. Similarly, when we're thinking about cannabis, especially if it's something where it's for spasticity or pain management, that's often something that's been discussed with your doctor, physiatrist, or other kind of medical team members. And so one thing to check in on is, am I using any more of this than my medical team member has prescribed or has recommended? And would I be concerned at all to be honest with them about how much I'm using or when I'm using it? And again, if the answers are yes to that, that could be a sign that it's a moment to check in. Certainly, again, there's quite a degree of variance there in terms of when something becomes a problem. But if we're looking at something where it's starting to cause any difficulties in day-to-day activities, if it's getting in the way of any relationships, causing those disagreements or arguments or tension, if it's causing more difficulties in terms of self-care management, things like more difficulties with bowel or bladder accidents that are surprising to you, or difficulties with some of those activities of daily living. That could also be a sign that it's starting to get to a degree that some attention towards it could be helpful there. And if you are finding that it's something that, you're answering yes to these questions or reflecting and thinking, I'm using it more or I'm using it more often, there's different ways then that you can think about making changes in your life if that's something that you're kind of nodding along to. And so we can think about, lots of resources online that can give guidance and information for different types of substance use and how to reduce that over time. We can also think quite basically, are there different ways that this has kind of started to be part of a routine for you in the pandemic that's different than before? And so for some people, for instance, it was those social times that we're finding that we're using substances, or we're having that additional glass of wine in those moments. And so perhaps it's making changes there. For some folks, it might be that it's a certain time of day or a certain routine of perhaps, getting home after an outing and then having that glass of wine or that beer. And is there something in that routine that could be shifted? I really liked, Brad, how you were mentioning there that for you, staying healthy is one of those goals for you. And we can use those types of goals that we have in other areas of life to also just help refocus and put kind of other priorities into the highlight for us. We can think about different specific activities that would be kind of in line with other things that we want to do, other tasks that we want to get done. Or are there different people that we could reach out to fill that time instead, perhaps? What are the different ways that I could shift those patterns, focusing on my goals or those things that feel important to me to give me that reason to shift away from this thing that started to become more of a pattern?
I think one of the challenges it's weighing out too. I find having drinks is fun. And, there's enough other fun things that we've all had to give up during this time. So, there is that balance of, recognizing that, to be healthy and not drink as much, but at the same time, to a degree, it does feel like another one of those fun things that, I've given up. So, while I've been able to keep it in check, it is a struggle, and food as well, enjoying having certain foods when you go out that I wouldn't normally have at home. It's fun, and you miss that. So it really is a balance. I don't know how you're coping, Linda, with that.
Well, I think when you said now that you're going out, because I have gone out a couple of times now, 3 times, venturesome being that I am, to patios and distance, and I do find that it's like, I've been so deprived for so long. I've got to treat myself to this. It's just one thing, and for me, that it's a real struggle. I've talked about it before. It's a real issue for me, more so than the cannabis, because that's a total non-issue, and the drinking. But I think that it's kind of that balance between wanting to eat healthy and keep it reasonable, and the fact that you're finally getting out and you think, oh, when am I going to do this again? Because and I know we're heading that direction, talking about worries. You're kind of worried about, am I just going to have a little snapshot and then I'm not going to be able to do stuff again? So I've got to take advantage of that. But oh God, my body doesn't need that extra bit because it isn't healthy and it doesn't help a lot at all. So it's a real tricky thing, Yeah.
I was so glad that you mentioned that, Brad, and I had a little laugh to myself there as you mentioned that, because it's one of these things that sometimes we don't like to put on the table, that, having a glass of wine with friends can be fun. Having a nice dinner out at a restaurant can be fun. And that idea that there is a reason or a function that these things are serving for us is an important thing to recognize when we're thinking about why these things can kind of become part of a routine for us, or why they can become more entrenched. There's a reason there. It feels good in some way. It's helping to fill that time. It's distracting us. That can actually be a really important piece of making any changes, if it is something where, when we're thinking about it, you recognize within your own life that you do want to make changes. if we can validate that truth to the situation, that reason or that motivation, and then also look at the other pieces of the context, that can help us to validate ourselves and any of those difficult moments that come up, but also at the same time refocus on those goals. Keeping that balance there between why is this happening to begin with, or why am I turning to this to begin with, and also what else is important or what else is within my control or capacity here to try instead.
There's also that opportunity to look at it and look at some of these things we're missing and realize how much we do enjoy them and why we enjoy them, instead of just kind of plowing ahead and just doing them because we've always done them. You know, a simple thing like having a glass of wine with friends, you realize how much you do enjoy it. And I'm hoping that, it's going to be one of the positives as you move forward, is that you realize how much, we do enjoy that, and how lucky we are to be able to do that in a normal time here. Yeah, again, it's putting that positive spin on a bad situation.
Really highlighting those reasons that those things matter and those values, those key values within there. That's a lovely thing to think about.
But I think that really does emphasize for me, when I look back at the part of life, that eating out with friends, like I ate out fairly frequently with friends, and we'd often share a meal. It was sort of, and going to the movies, going to see the indie films and going to, concerts and stuff like that. That very much was a more significant part of my life than I had realized, now that I have had a gap from it. And what do we look at and do, and what particularly do I look at and do to fill that gap? Because that is a gap and it's a bit of a hole.
Mm-hmm, mm-hmm.
Get a lot of enjoyment out of it. There's a lot of pressure there.
Those are such important things to be recognizing there, I think. And one of the things that we really can give credence to through this period is the grief that comes along with major shifts of life like that, where we're thinking about these things that are valuable in our lives that have been taken away without us asking for that to happen and without us really knowing that it was coming in that way. But regardless, that change has happened. And I think being able to look at that as a true loss in that way can sometimes help us to understand some of the emotions that come with that and some of the ways that can affect our lives. Just in the way that, spinal cord injury is not only stressful in the acute phases of injury, although it may be differently stressful in the acute phases of injury. The pandemic for each of us is not only stressful when we are individually suffering with COVID. It is also stressful at other times and in other ways. And so I think bringing that acceptance and that space for those thoughts and for those emotions can be a really nice piece of helping ourselves to cope with this thing that is so outside of our control, while also then, not staying with those thoughts or feelings forever, but eventually refocusing on what can we do, what is within our capacity, what are those values and goals that we can engage with that make us feel good. So again, coming back to that idea of balance and how do we try to give voice and space for each of those pieces within our lives.
Thanks, Rachel and group. That's an excellent segue into our next topic, which is a lot of people have been feeling, and I've been feeling, and I've been hearing people have been feeling, is worry. There's worry about what's going to happen next, worry about when do I go back to work, when can the kids go back to school, or something that we're just seeing everywhere in all kinds of different iterations. Maybe Linda, did you want to start and chime in on about worry in the time of COVID?
Oh, I'm not worried at all, Matt. I outright lie. I think that for me, the kind of all the worries around this whole idea of being here in Vancouver and getting to my family over on the island and taking a ferry, or, it's not really essential, but how do I support them, and worried about how things are going, and kind of weighing that out between a reasonable kind of response to myself about what's realistic to worry about and what you just have to word and say, okay, let go of it, move on. Just try it out and move on. So, and there's the legal worries, that are going on about whether or not we can, we can keep on going at a certain level. How do you balance that out to kind of make it more realistic for yourself, that you can still enjoy life. And don't get me wrong, I think there's still a lot about life I do enjoy and a lot of interactions and richness there. There's still a lot of positives, but there is that niggle there about, how long is it and how vulnerable and all the rest of that kind of stuff. I don't know, your thoughts there, Brad?
I don't know. I mean, worry in the time of pandemic sounds like a sequel to Love in the Time of Cholera or something. That's what I keep thinking. But, I don't know. For me, again, I feel fortunate to have that ability to take things generally one day at a time. Being able to be grateful for the supports I have, knowing I have these hobbies and things to keep me busy. But, you do start to worry. I do find times where I start to worry, but I know I'm able to tap into, those positive reserves that I have and get myself out of it. But, I do think about people in our community that we have reached out to and people that I haven't heard of. Some of them we don't know well enough that I would normally interact with, like outside of the gym, so you don't have their number or a way to contact them. You do worry about that. I think that would be my biggest worry, is more other people. My parents getting older and they're still out in the community, both working, that kind of stuff. Worrying that, they are getting older, and how you'd never know how many more years you have with them. And now here we are not seeing them. I normally would see them all the time, and you're not hugging them, and it's that niggling feeling in the back of my head, what if they're suddenly gone, and you look back on this time and go, wow, that was a couple of years wasted where I didn't make the most of those relationships, with keeping safety in mind, right, both your own and other people's. So I think for me, those are some of the things that I worry about. I don't know if those are things we always talk about, but
I think those are very fair worries to be having in this time. I think that it would be unreasonable to expect any of us to be going through this pandemic and not having more worries than we might when we're not in a pandemic situation. There are a couple things that you both mentioned that I think are worth kind of coming back around to just consider. And one of the things that I think we can notice is how our worries connect together for each of us. That oftentimes it can be that there's that first kind of starting point. Maybe it's that to-do listing that we're thinking of. Maybe it's that phone call that we need to make. And we start to think. And because we have these wonderful brains that are so well equipped to think forward and to think of uncertainty, and to think of uncertainty in threatening ways, we think of all these what ifs, particularly bad what ifs. And we can start to have these more catastrophic or worst case scenario thoughts that come in. And so one of the things that can be helpful for us, if we're starting to notice that this worry is getting to be kind of excessive compared to what we would consider normal within a pandemic situation, so compared to how others might be worrying who are in a similar context. Or if it's getting to the point that these thoughts are intruding, when you're trying to think of other things, you can't keep them off your mind, or they just keep coming and feeding that anxiety in a powerful way. That can be a time to start to address these thoughts and these worry patterns more directly. And so we can think of different techniques and tools. There are lots of different ways that we can challenge worry. Lots of different therapy techniques or thinking techniques that we can do to deflate the balloon, so to speak, to kind of reel that chain back in from that worst case scenario that we get to coming back to the starting point. There's also different things that we can do sometimes to problem solve in our lives, as well as supports that we can reach out to. And so just taking those very briefly one by one there, one of the things that we can do with worry thoughts is practice decatastrophizing our thinking. And so if it's the case that we notice ourselves going to that worst case scenario, quite automatically we just go right on over there a few steps down the road. If it's the case that that thought is in the future or it hasn't happened yet, Brad, you were mentioning, I'm noticing my parents are getting older. I'm wondering how many years they have left and whether we're going to regret this time, for instance. And so that's a good example of a very fair type of thought, but that is more in the future, not something that we can hold kind of in the here and now. And so if we can take that type of thinking and think, okay, how can I bring it back to here and focus on what is within my capacity to problem solve here, and what are any of those worst case scenarios that I can challenge gently. What's the worst case scenario? What's the best case scenario? What's the most realistic? Those can be things that can make us feel that we're coping with an uncertain situation. And overall, I think, when we're thinking about worry, we're often thinking about uncertainty. And we're thinking about things where we're having to sit with something that doesn't feel comfortable in that way. We want an answer. We don't want it to feel like that. And so the more that we try to find those answers, we can find ourselves working overtime almost, going to all those news sources, reaching out to everyone, working to the extent that it feels like we're working as hard as we could, but not necessarily getting anywhere. And so that can be another time as well where coming back to the present moment, refocusing on what's within our capacity here and now, and trying to practice acceptance of that uncertainty can be very helpful. Lots of supports out there online or in self-guided formats, whether that's books online, opportunities for telephone or email therapy are sometimes available. Sometimes there's support groups out there, but also your GP can be a really great connection point there for connecting you with different types of resources. And for some people, a pandemic is a time when they may be considering medication when they might not normally as well. And that's okay. That's not something that we would shy away from just because it's something that's related to mental health. If you were a diabetic, we would give you your insulin. If it's something where you're struggling with mood or anxiety, we can look at different strategies, tools, and techniques for that as well.
Rachel, something came to mind when you were talking, and it's, we talk about worry, but we're also talking about reaching out to other people. And Brad had mentioned, there's people that we don't know well enough to know their telephone numbers, but connecting and worrying. And I know sometimes when I'm reaching out and talking to people, if I hear a flat effect and there's no interest, that I get a little niggle of concern for them. So I guess I'm wondering if you could talk a wee bit about what are the signs to look for when someone is not as mentally healthy as they could be and starting to be in the at-risk area. So if you could speak on that, that would be great.
Absolutely. And I think that is, I will just say at the top of the question here, a lovely thing to be thinking of as well. Really looking for how you can be aware of those others around you and just looking out for everyone, which I think is a lovely part of the community there. Within this SCI community, everyone's always looking out for each other, and that's a great thing. Certainly, it is more difficult when we don't know someone as well, when we don't have that kind of starting point of what to expect from that person. That is objectively a more challenging situation there. But if it is someone where we have enough of a familiarity with them, that we would know their general patterns, we can take a look for changes in things like how they are taking care of themselves. Are there changes in things like sleeping, eating, self-care, hygiene? Are they not attending their appointments? And they've mentioned that, and that's been a bit of a pattern that's new for them. Are they withdrawing? Are they someone who used to be that social person who would always be there at that book club, for instance, and now they're not answering emails, or they're habitually turning it down for some reason? Could that be a sign? Perhaps. If you're noticing that they seem to be quite flat, as you were mentioning, not responding to things in a way that they would normally respond, or to the magnitude that you think that they might normally do, that can be a sign that, again, things have changed for them in some way that we could be thinking about looking out for. We can also think about things like changes in other types of behavior. So if a person is repetitively asking for things like reassurance about the pandemic, about cleaning, about other sources of worry or concern, that can be a sign that someone is struggling with anxiety or low mood and is having a difficult time coping. Certainly, we spoke about substance use earlier. If you're noticing changes in folks who are close to you in terms of how much they're using or when, that can also be a sign that something has changed for them. And certainly, if anyone is starting to notice their friends or others close to them talking about hurting themselves or ending their lives in some way, that is something that we would always want to take seriously, even if it's the case that the person perhaps doesn't mean it seriously. Giving that moment to just reflect and say, hey, you know, that's a serious thing that you're mentioning there. Is everything going okay with you? Do you need to talk about anything? Or is there anything that I can do to support you? That can be a good moment to check in, even if it isn't the case that the person is struggling to the extent that their words might suggest. And so overall, we're thinking of enough changes that it makes you think, or it makes you kind of question whether things are okay with that person. Some people are better at hiding that than others as well. And so that is also why I think that it is just a lovely thing that you're even thinking of checking in with those close to you to see, you know, is there anything that a person might say? If we ask them directly, how are you doing? How are things going for you? What's going well and what's not going well right now? And then, you know, are there different ways that we could offer them support? Recognizing as well that we can't force another person to, you know, use those supports or follow through, but that being there in that way and helping them to know what's available is always going to be something that's valuable in terms of being a team member for that person.
I guess I'd like to just make a point too, when, you know, we're talking about us reaching out, that when reaching out and having these discussions, there's also been times where it has some very meaningful, rich discussion as well. So it's not a one-way street. There's a real exchange there, and there's been a real, almost an intimacy at a certain level, emotional intimacy with some of the discussions that maybe didn't happen as easily previously, or did happen in different circumstances. So it's not just reaching out and wanting to touch base. There's a reciprocal portion to it a lot of the times too.
That's such a lovely point that you're bringing up there, that feeling that it's not just that almost work side of, you know, reaching out to connect, but that there's that real feedback that we get from connecting with other people, and so many different ways that people can give us great ideas and inspire us in different ways as well. I can't count the number of different times that I have been inspired by folks that I work with in terms of different ideas for coping during this time, different resources that are out there. And those are things that I never would have heard of if we weren't just chatting about different things. And so certainly a time where we can think of that opportunity kind of perspective as well. I like that idea.
Thanks, group. Super important time to be reaching out, and super important time to be noticing changes, you know, in yourself or in your group. And super important time to be maintaining our overall health in addition to our mental health. And I know, Linda and Brad, how connected you are and how important your physical health is to you, and going to the gym and having that community. How important is maintaining your physical health for keeping your mental health in check as well? Maybe I'll go to Linda and Brad first and then ask Rachel's opinion.
You want to start, Brad?
Sure, yeah. They're completely connected in every way. I noticed very quickly, even on a day-to-day basis, that if I'm not getting some kind of exercise, that, yeah, the mental health does start to, you know, struggle. I mean, maybe not in a huge way, but I just know I just don't feel as good, you know, mentally, spiritually, however you want to put it. So it's always, you know, that's part of the routine is morning workouts at the gym, at least 5 days a week, and then some different things on the weekend. But, you know, also when you do have a rest day on a Sunday, which is usually my day to do nothing, you feel like you've earned it. So you can enjoy a day off and kind of guilt-free. So I think that's the big thing, is the physical kind of takes care of the mental for myself. And as long as I'm keeping physically active, and not just exercise, but, you know, the diet stuff as well is huge. As long as those two things, physical things, are in place, the mental sort of tags along. It's much healthier as a result.
Yeah, I would agree with you, Brad. I find that the exercise makes a huge difference to me. It was getting up in the morning and, you know, starting my day by doing the yoga and stretching, and then either rowing or walking or doing something. And if I was feeling like, oh, I don't know, I want to say a bit of a funk, but I don't know what, just not, I know that for my mental health, I need to get outside and go for a walk, and it's just be out in the fresh air and the sunshine. So it's the combination of the exercise and the fresh air and everything. And also, quite frankly, even though we're physically distant, I do meet occasionally people on the walkway, and you get to know them after. Well, since the beginning of March, you may not have known them very well before, but you get to know the little four-legged friends that come along and come over and say hi and all the rest of it. So that also, to me, elevates my mood and puts me in a good space, and they always have it. Most people will chat very briefly, a social chat interstage, but it's still a connection, and it still helps me. The combination of the exercise, the fresh air, and the connection helps my mental health and helps me maintain that. So.
Those are such great points that you both brought up there. And just to highlight some of those pieces that you were both describing that fit with the research as well on how we know we can support mental well-being over time. One of the things that you were both speaking to is that idea of having a structure that gives you different things in your day-to-day life, particularly things that make you feel like you're taking care of yourself. And one of the things that we know in terms of mood is helpful is what we call behavioral activation. And it's the idea of becoming active or engaged with things that are helpful for our mood in some way from a basic standpoint. And so that kind of boils down to doing things that make us feel that we've accomplished something. That kind of feeling of self-efficacy, yeah, I did that, I can knock it off my list. Whether that's to-do list things, I don't know for you two if exercise falls more on that, into that domain or more into the kind of enjoyable domain. For me, it might be more into the accomplishment side of things, but those are things that really allow us to challenge any thinking as well, that we are not able to do anything to help ourselves in the moment. The more that we're able to do even small things, whether it's 5 minutes, 10 minutes, 25 minutes, an hour, the more that we're able to engage in these things when we don't feel motivated or when we don't feel good, we're challenging that negative automatic thought or that prediction that I'm not going to like it, or it's not going to feel good, or I can't do this. And we're actually showing ourselves, yes, we can, or it's not as bad as we think it will be, or we feel so darn good afterwards that it's worth it anyway. And that combined with different types of things that we just like, those hobbies or social connections that just make us feel innately good. Those are different things that really support us feeling good over time. And Linda, I really like what you were saying there about the social connection piece as well. This kind of indirect social connection just while you're going about your day and doing other things there. Because certainly we often think of social connection when we are talking to others or really engaging with them in a more direct way. But we can also get benefits from seeing people, engaging in routines, having that hi, even if we don't exchange more than that. Just reinforcing that we are seen and that we're seeing others and can have that brief moment where we're just smiling at somebody. And that can also be really powerful for our mood as well and can help us shift away from any thinking patterns that can be quite automatic in times like this, that it's never going to end, that it's hopeless, that we can't do anything to help ourselves. All these little things that we can do can just chip away at the foundations of those more negative thinking styles and can really help us to just keep that helpful pattern going of engaging with things and challenging that thinking. And from the physical side as well, just to piggyback that piece, both of you were speaking to kind of keeping those health routines moving. And certainly when we're thinking about stress and just buffering against stress, the more that we have that foundation set of that physical well-being, that sleeping pattern, healthful eating in general strokes of the term, allowing moderation in there for those pieces of cake or ice cream here and there, making sure we're hydrated. Some of these basics of just taking care of ourselves can make us feel more able to handle stress than we would if we're tired or if we're hungry and if we're not feeling as good to begin with.
So we are building some resources on the SCIRE project website, as I mentioned, with regards to COVID and SCI in particular. You'll probably see Brad and Linda in our physical activity. We'll speak more about physical activity in that video where they're going to show you specific exercises and that kind of thing. So check out those resources and others on SCIREproject.com. As well, what other resources, maybe I'll ask Rachel specifically, are there any websites, any books or anything that you're kind of recommending at this time in particular?
Absolutely. When we're thinking about different resources, sometimes the difficulty is that there's so many out there that we don't always know where to start. And so I will just say that all these resources that I'm speaking to, I'm not affiliated with in any way. These just happen to be some that I personally enjoy. Don't feel bounded by that. Let the adventure take you where it will in terms of finding different resources. But some that I particularly find helpful and that are evidence-based include the Vancouver Coastal Health Kelties Key website, which is a nice collection of modules that talk through common difficulties with things like mood, sleep, anxiety, some of these really common themes that have been coming up for folks during COVID times, but also generally as well. And so that can be a really nice resource in terms of self-guided practice and just learning a little bit more about what's going on with some of those things there. There are also a lot of fantastic resources on the Anxiety Canada website. And there they have lots of resources both for adults and for youth as well. And so that can be a great resource in terms of mental health. There are different types of sites as well when we're thinking about COVID-specific resources. We've spoken to some of the general health websites already in terms of things like Health Canada, so certainly stay informed through things like that. Some authors have put out books from a mental health perspective that are specific to COVID or that are resources guided specific for COVID as well. And so, for instance, there's an author named Russ Harris who recently put out an edition called Face COVID that has some general tips and tools and techniques to help yourself cope with the difficulties and uncertainty that comes with this time. Certainly, though, those are only a couple of options, and I would encourage you to reach out to those in your community, those closest to you, your GP, or any other team members that you already have on board to ask whether there are any specific resources for you that they already know of that may be helpful as well.
I'd just like to add to Bounce Back has some good resources too.
Yes, that's a fantastic resource as well. Great stuff there.
Yeah, thanks to both, and I'll echo Rachel's. We're not affiliated at the SCIRE project with any of the resources that we've mentioned and recommended, but we do vet them so that they have to be evidence-based in some regard for us to put up anything on the site. So look for those on the site in our SCIRE COVID section. Any final thoughts from our panel on mental health, spinal cord injury in the time of COVID?
I guess one thing I'd say, the last thing I'd say is just to remember to be good to ourselves. You know, it's easy to beat ourselves up through all of this, and all these changes and challenges. It's kind of new to us. You know, we're not always going to get it right. So just remembering, you know, that we're kind of winging it right now, and yeah, to recognize the successes and the wins.
Yeah, I'd certainly support that. Just be gentle with ourselves and with others.
So I think what I would say just as an ending point is to just make sure that you're checking in with yourself. And if you notice any changes in your thinking, to just take that opportunity to look at whether that thinking is fair to you, or are there any of those biases or any ways that your thinking is pulled more strongly in a certain direction than it may have to be. Can we help ourselves with that? Are there any things that we're doing that we've shifted away from in terms of helpful structures that we can pull on back in? And like Brad was saying, how can we do that in a way that's gentle to us at this time? Recognizing that this is a different time and that setting the bar for ourselves at the same level that we would normally set it may not be realistic at this time. And that doesn't mean that we're not coping well or that we're not trying hard enough, but that each day is going to be a little bit different, and just trying to be mindful and try our best is a very, very good start for each of us.
Great advice from all of our panelists and discussants. Thank you so much for participating. People, if you like this video, please like, share, and subscribe to our website and our YouTube channel. So I want to thank our panelists, Linda Hunt, Brad Skeats, Rachael Neal. Thank you so much for your insights and their discussion. I'd also like to thank our funders for this initiative is Praxis Spinal Cord Institute and Ontario Neurotrauma Foundation, as well as our partners who are always helping each other with like SCIBC, ICORD, and via Vancouver Coastal Health Research Institute, all our folks at GF Strong and UBC. So thanks everybody. Take care. Look forward to speaking with you more. And yeah, take good care of yourselves and each other.